Good evening. It's Saturday, May 2nd, and it's an unusual time for a legislative update from your North Carolina Medical Society. But we wanted to be the first to update you on the coronavirus relief package that the North Carolina General Assembly passed today. So let's get started. The House and Senate met and agreed upon a package of $1.5 billion. And this is kind of in between the monies that we saw suggested by the governor, the House, and the Senate. So kind of fell in between all of their suggested priority areas. So let's get started talking about the policy bill. So in exciting news, the North Carolina Medical Society was able to help get the medical liability protections that we fought so hard for in this legislation. As a reminder, it was in both the House and the Senate versions, but we are thrilled to have it in this final version that has been sent to the governor. Now, in terms of telehealth, the House version did have telehealth parity in it. The Senate version did not. And unfortunately, that provision did not make it into this coronavirus relief package. But we are hopeful that we can continue this conversation, particularly with the Senate, to talk about why this is so important to our practices during this pandemic, and that your decrease in patient volume and your increase in seeing telehealth patients really warrants addressing this issue. So that's something that we're hopeful can be addressed as legislators come back and look into further detail about other issues moving forward. But they did suggest in the legislation for Medicaid and Medicare to cover audio visits or visits via telephone. So we were glad to see that be included in the language. And finally, on the policy piece, I want to note that a change was made in this bill to allow the public to wear masks. So previously, it was actually against the law in North Carolina to wear a mask in public. But now in this policy provision, that has been changed. So we were thankful that that hopefully will help increase the number of people who are wearing masks, to let them know that it's okay to do that in public, and hopeful that they'll continue to do so. Now let's talk a little bit more about the funding portion of this bill. So in very exciting news, the North Carolina Medical Society received an appropriation for $5 million to purchase personal protection equipment for you all. So we are thrilled to be able to put that to use. You may have seen the platform that we're beginning to use for that this week. So we're excited to be able to get more supplies in your hands as quickly as possible. So I'm thrilled to see that in the bill. Also, on a small business perspective, a number of you have reached out to us about financial support, but this bill actually appropriates $125 million in small business loans to the Golden Leaf Foundation. So if you're interested in that, be sure to look at the Golden Leaf Foundation website and figure out if that would be a right fit for you and your practice moving forward. But that originally started out as a $25 million appropriation, then became a $75 million appropriation, and they ultimately decided on $125 million. So we're very hopeful that this can help some of our small businesses and our physician practices. Also on the Medicaid side, we saw a 5% bump in all Medicaid fee-for-service payments. And we really recognize that this is due to the legislature understanding that you are seeing a decrease in patient volume, and they hope that this small increase can help give you some support during this time when you're seeing that decrease in numbers. Also on the Medicaid front, we saw payment or coverage for testing as a part of Medicaid. This was included in the bill, and something that we were excited to see, that testing for coronavirus would be covered under the Medicaid program. Also, I want to point out that all of the medical schools receive some type of financial support from this bill. So glad that our legislature recognizes the importance and academic credibility that all of our medical schools bring to the table. And that's to cover rural health, vaccines, and a number of other projects that the different campuses are working on currently. And finally, I want to point out that our friends at the Old North State Medical Society received a $1.8 million appropriation to look into health disparities in coronavirus. So we're thankful to see that included and part of the conversation to see how we can better address this issue and other issues as they move forward. Now, the legislature is not done. They're set to come back in 2 weeks. The House has said that they'll continue their coronavirus working groups. So as you take a look at the blog and see the real breakdown of different appropriations that I didn't mention specifically in this video, let us know if there's something that's not there or something you'd like to see addressed, because this is certainly not the end of the conversation. the legislature has let us know that as soon as more federal money is able to draw down, they're likely to pick back up, coming back into a regularly scheduled session. So this is not the end of the road, just the first step. So we look forward to hearing from you. We're so thankful for the support that you've given us during this time and your grassroots efforts and help and phone calls and action alerts. It has really helped make a difference in this time when we weren't allowed to be physically present in the building, but still gave us a presence on the ground. Thank you for all you're doing for your patients. We're so grateful to work for you, and we look forward to talking to you again next week. I hope you have a great weekend.